Hello and welcome, everyone. I'm Nuri from the Massachusetts Health Connector. I'm joined by my colleagues, Nikki and Melissa, who will be presenting today's information. Together, we're here to share information about open enrollment for plan year 2025, whether you're considering changing health insurance plans for the upcoming year or enrolling in coverage for the first time. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, though, we just want to share some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes. Then we will have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout, and I will note that we are expecting a large crowd, so I'm sure we'll have several questions and we'll do our best to address as many questions as possible. Please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local assister. Lastly, we are recording today's webinar, and following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. That being said, I'll hand it over to my colleague Nikki to get us started.
Thanks, Nuri. And again, thank you everyone for joining us for today's presentation. It's so good to see the numbers continuing to tick up, so we know that health insurance and health coverage is very important to all of you. I am going to take us through information today, probably take about 20 minutes or so to get through this content so that my colleague Melissa can do some demonstrations with you. So overall, we're going to talk about the Health Connector. We'll talk about open enrollment, about applying and changing coverage. We'll talk about any deadlines that people need to meet. We will spend time talking about our health insurance plans, in particular, our ConnectorCare plan. And then we will talk about ways to compare plans, how to save dollars. Melissa will be doing a demonstration on how to do that. And we will spend some time looking at resources that are available to help you beyond today's webinar. So before we get into what is open enrollment, I wanted to level set and talk about what the Health Connector is. For those of you who aren't familiar with our organization, we're the state's health insurance marketplace, and we're here to offer individuals, families, and small employers access to affordable health insurance coverage. Now, you might be wondering who exactly gets coverage through the Health Connector. And really, it's people that don't have access to health insurance, either through their own job or through a spouse or partner. A lot of people who enroll in Health Connector coverage do qualify for help paying for their premium. So we don't want to discourage you from thinking of, just looking to see. We'll show you our Get an Estimate tool where you can just check and see if you might be eligible for some savings. Also, we have dental insurance that can be purchased. And we won't cover this today, but it is important to mention that we have a product line called Health Connector for Business, and that's for small employers with less than 50 full-time employees. That's where they could shop and compare their health and dental plans for them and their staff. So I'll start off talking about Health Connector plans. So what do you really need to know about all of our plans? We want you to feel confident and assured that all of the plans sold through the Health Connector meet state and federal standards for coverage. So these are comprehensive health insurance plans, and they're known as qualified health and dental plans. So depending on where you live in Massachusetts, you're going to be able to choose from a variety of plans from leading carriers in your area. Now, because we're the state's marketplace, you can find out if you qualify for advanced premium tax credits. And these are federal tax credits that people qualify for that reduce the cost of their monthly premiums. And I'll spend some time going into that in detail. In addition, in specific to Massachusetts, we have what's known as ConnectorCare plans. So people in certain income levels who meet other eligibility requirements can qualify for low or no cost health insurance coverage. So open and closed enrollment. So this is a big time of year for us in that anyone who needs health insurance for any reason can come in, and they don't need to have a special reason to apply for coverage. Now, open enrollment runs through January 23rd, so you still have time. And then beginning on January 24th, we start our closed enrollment period. So let me just explain that a little bit. So, as I was saying, open enrollment is a time when you can apply for new coverage for the coming year, or if you're an existing member, you can renew your coverage or shop for a new plan. Our open enrollment runs from November 1st to January 23rd. And even though we're past January 1st, we're still in this enrollment period. So you, as a consumer, can review the available plan choices for coverage that will start on February 1st. Couple of things that are important to note is all Health Connector coverage begins on the first day of each month. So if you are looking for February 1st coverage, that starts on February 1, you need to apply, enroll, and pay for your coverage by January 23rd to meet this deadline. Now, I'd like to talk about COBRA at this time because we usually get so many questions about this. So, wanting to encourage you to consider Health Connector plans as an alternative to enrolling into COBRA. Now, if somebody loses employer sponsored coverage, that's considered a qualifying life event. And that will always give you a special enrollment period for enrolling through the Health Connector. Or if you have an opportunity to enroll in a spouse or partner's plan, that will also give you a special enrollment period to enroll into their plan. But if you're coming to us and you've lost health insurance that you had through a job, you need to apply within 60 days of losing that coverage. So the sooner you apply, the sooner your new health insurance can start. And you know, we're in a good place right now because, even if your special enrollment period is over, because we're in an open enrollment, you can, in fact, consider Health Connector coverage as an alternative to enrolling into COBRA. And we know that COBRA is typically, cost prohibitive for people. It is the full cost of your health insurance plan that you were enrolled with your employer. So something to consider if you're in that situation. All right, so let's move into timelines and deadlines. What needs to be done right now? All right, here I want to just ground us in the application for individuals and families. This is the landing page, and this is what it would look like if you went to our website, went to mahealthconnector.org, and then clicked on login. So you're seeing this page on the right. And it's important for me to point out that you can apply now. We have an application in English, also in Spanish, and also in Portuguese. And there is one application in Massachusetts for health coverage. So you don't really need to know what you're applying for. You know that you're applying for health coverage through the Commonwealth. However, you may find that someone becomes eligible for a Health Connector plan. Another person becomes eligible for Mass Health. Another person becomes eligible for a Health Connector plan with some savings associated with it. So really, we hope this one door helps to make things a bit easier for Massachusetts residents. Now, on the right-hand side, where you're looking at the image of our screenshot, I just like to point out that if you've ever applied for health coverage before with us, you would want to use the sign in. We wouldn't want you to try to create a brand new account. Anytime you'd created an application, you can always go back to the previously submitted application and just make updates. That will be the easiest way for you to get through the application. Now, what if you're an existing Health Connector member or you're a new applicant? Are the steps really that different? it is, regardless of who you are, both types of people can shop and enroll in a plan that starts on February 1 because our open enrollment period isn't ending until January 23rd. So you'll see on the left-hand column, we talk about updating or submitting your application. So if you had a previous application, you're an existing member, or you had an application before, please don't create a new one. Just log into your old application. You want to report any changes to your household. So did some income change? Have people moved out or moved in? Like who's on your, and we'll talk more about this later, but your household really is, from a Health Connector perspective, your tax filing household. Now, if you are newly applying, you need to start with the online application. That's the first step, submitting an application. And then for step two, once you have completed this process, you're going to see your program eligibility online, and you'll see if you're eligible for savings. In addition, if you need to submit any proof of information that you entered into the application, you'll get that notification online. So if you owe any document proof, let's say a residency, or if you owe a proof of income, those need to be submitted within 90 days. Now, step three, this is for everyone. You want to shop, you want to compare your plan options, and then you want to enroll into a plan. Now, your enrollment isn't completed until you have paid for your premium if you owe one. So, right now, the really critical dates are January 23rd. You have to take all these actions by then so that your coverage can start on February 1. Okay, so a little bit more detail on who can apply and who should not be applying. So if you live in Massachusetts, you need to be a US citizen, a US national, or considered lawfully present in the US. And you need to be someone that doesn't have access to affordable, comprehensive health insurance. Now, this could be through your own job or through the job of a spouse or partner. We're really here for those people that don't have access to that coverage. So if you are already enrolled in Medicare, the Medicaid program, which in Massachusetts is known as Mass Health, or you have other public health coverage that's comprehensive. We know that some veterans benefits are very comprehensive. If you have one of those, or you're offered affordable comprehensive health insurance coverage from an employer, through your spouse, your partner, yourself, you would not be eligible for savings through the Health Connector. Now, what kind of information do you need when you're applying for coverage? You want to gather social security numbers for everyone who is applying, if they've got one. If you have any immigration documents, or members of your family have immigration documents, you want to gather that. When you are applying for help paying for your coverage, we will ask you questions about income. So we'll want to know about your pay and any other type of income that you might be receiving throughout the year that you're aware of. So in terms of proof, we might need copies of your last two pay stubs. If you, let's say, you're a contractor, or you're freelancing, we will need information about your self-employment, your net income. Or you might be somebody who's currently collecting unemployment. If that's the case, no worries. The department, I actually can't think of their name, Department of Unemployment Assistance, excuse me. They have a document called a monetary determination, and that's something you can get online. You just want to get that amount right from that document, and have that handy when you're completing the app. Now, as I mentioned before, if you don't have all of the information at hand when you're going through the process, we will tell you that we need proof. But please, we don't want to deter you from applying. enter as much information as you have available to you to complete the process, and you're always able to come back into the application and make revisions. We get lots of questions about income sources that need to be included. So when you are estimating the income, today is a great example because we're at the start of 2025. So you're going to be asked for an estimate of income for the year. So these are the types of things you want to consider. You want to consider wages, your salary, tips that you might be making, alimony that's being received. These are all taxable income. So we have a more comprehensive list on our website. And I know Nuri mentioned this, but I will mention it again. Really, there's no need to take detailed notes or even jot down URLs because you will be getting this presentation with all of these links. Or you can simply go to our website, mahealthconnector.org, and you can find this information online. Now, let's say you apply. You've completed the online application. What do you need to do after that? You're going to want to open the mail that we send you. Because we have a joint system with Mass Health or our Medicaid agency, you will get a letter from both organizations. If we need more information about you, your application, or someone in your family, we'll send you a letter. If you need to submit required documents, please do that within 90 days, and that will help avoid delays in your coverage. Now, I briefly mentioned that you can come back into your application. So I just had a conversation with someone earlier this morning, and they were asking about, how to properly enter information. If it's the start of the year, they may be looking for, their income, their job income might go up or might go down during the year. And you just need to be as accurate as is possible at this moment. And then you can go in and you can update your application. You can update your income. Now, what this will do, keeping your information as accurate as possible, is going to lower your IRS debt risk during tax season, and I'll explain that. And also, I'll explain that you can change the amount of the tax credit you receive. So we'll go through that in further slides, but again, if you need any more detailed information, it'll be available on our website or if you call customer service, and we'll give you that information as well. All right, I want to talk to you a little bit about the ConnectorCare program and what is new and available to you and pricing for 2025. So I've talked about this slightly, but there are two distinct ways that you can get payment help through the Health Connector. The first, that's advanced premium tax credits. And remember, that is because the Health Connector is the Massachusetts state-based marketplace. So we are able to help determine if someone is eligible for federal advanced premium tax credits. Now, those dollars lower the premium amount somebody will pay each month. The IRS sends your tax credit directly to the insurance company. So all you have to do as a consumer is simply pay the lower amount. So you just pay less for the monthly premium each month. And as a tax filer, you're going to see if you're eligible for advanced premium tax credits. You're going to see a full amount that you qualify for. That is your choice if you want to take that money in advance to offset the cost of your health insurance coverage. If you know already that your income is going to fluctuate throughout the year, you can adjust the amount of the tax credit that you want to take. If you want to just essentially say, hey, I know I qualify for $500 a month, but the overall income's a moving target, if you will. Let me just take $250 a month of that tax credit. You can certainly do that. You can adjust the tax credit amount that you take. It is a choice. Now, for the Connector Care program, I mentioned that this program is unique to Massachusetts. This is a program that combines your federal advanced premium tax credits plus Massachusetts state dollars. Those two together help reduce the monthly premium amount you pay. And when you enroll in a Connector Care plan, you're going to see that it has low monthly premiums, low out-of-pocket costs, and really, this importantly, no deductibles. You probably inferred this, but I think it's important to state it. The Health Connector is the only place Massachusetts residents can access state and federal subsidies. So again, the Connector Care program, we've recently expanded eligibility for this program. So there are going to be more people who are finding themselves eligible for the Connector Care plans. And if you find out that you're not eligible for the Connector Care program, you could still be eligible for advanced premium tax credits to lower your premium bill. And if you're wondering, which insurance companies, like what's going on with this Connector Care program? Like can I get plans through? These are really leading carriers in Massachusetts, and depending on where you live in the state, you would have access to those that serve your area. So really, we're so pleased that all of the carriers that participate with the Health Connector are now offering plans through the Connector Care program. And you may be wondering, since we've expanded the income limits for Connector Care eligibility, what does that really mean in dollars and cents for a regular person? So for an individual, the income limit for Connector Care is now $75,300 for plan year 2025. So if you're making that amount or lower and you meet all of our other eligibility requirements, you could be eligible for Connector Care. And for a family of four, the limit has increased to $156,000 for plan year 2025. So again, these plans are definitely worth a look. And as an example, if you're wondering, okay, what could I be paying if I became eligible for Connector Care? You are seeing tiers here. So the Connector Care program is broken up by plan type or tier based on somebody's eligibility, their income eligibility. And you'll see that as someone's income goes up, the amount somebody will be responsible for paying also goes up. Now, in the bottom two columns, bottom two rows where you see minimum monthly premium, you are saying for 2025, we are able to offer plans, at least one low-cost plan in every region at that price. So as an example, for plan type 3A, the lowest cost plan in a region would be $99. However, if you wanted to choose to enroll in a different plan, not the lowest cost one, you could see an increase of that in your monthly premium. However, you always have the option of choosing to enroll in the lowest cost plan. So apart from that, how do you compare options and save on Health Connector plans or health insurance in general? So there's lots to consider when you're shopping for health insurance coverage for yourself and your family. And we have some great online tools that can help, demystify this process. So most people, jump to the premium, the monthly amount that you would be paying each month. But we don't want to, that is of course important, but we want to think about covered benefits, all the things that are being covered through the plan, as well as your out-of-pocket costs. So every time you go to pick up a medication, or let's say you need to go to urgent care, or you visit a specialist, what is that going to cost you? And then lastly, the network. Are you someone that fortunately does not need to seek medical care that often? Or are you someone that has a particular need and you need a particular doctor, you want to keep that doctor, or you want to keep a specialist or keep going to a particular facility. So these are the things that you can consider and work with when you're shopping for your health insurance coverage. And I'll explain how and why in a moment. Um, the first thing I want to explain is getting an estimate. So if you just want to check out the plans and see whether or not you might be able to qualify for some savings, you can go to our website, and in the upper left-hand corner, you can click on Get an Estimate. You want to be sure to click on individual and family versus a small business, but you can easily see based on where you live and some and high level information about yourself, what is available in your area and if you could possibly qualify for savings through tax credits or ConnectorCare by completing an application. So that really is the first step. And I think that helps people to encourage people to move ahead and fully complete an application. Now, before you complete the application, you can also do some plan comparison. So you can find out if a particular provider you want or particular hospital, facility, health center that you want to go to, you can see if they're covered by a particular health insurance plan. So you can use the plan comparison tool. Now, when you've completed your application and you're at the point where you're shopping for coverage, those two tools are combined into what's known as our plan finder tools. So that is actually in your application. It's custom specific to you, and you're going to see the most accurate pricing and details based on the information that you entered into your application. All right. So I've said this before, but I think it's worth repeating. Enrollment into a health plan isn't complete until the premium payment has been received and processed if you're someone that is going to owe a premium. So if you're looking for coverage for February 1st, remember you need to take action. You need to apply or you need to update your application. You need to pick your plan and then pay for that coverage by January 23rd. So remember, there is still time this month. Now, if you are already a member, but you got a bill this month that you just weren't still not expecting, you also still have time to make a change. So again, it is still open enrollment. So keep that in mind. This is what a paper invoice would look like. And then in terms of actually making payments, just want to acknowledge that there are multiple ways a new member or ongoing member can make payments. You can make an online payment through our payment center. You can submit a check via the mail, or you can pay by phone. When you do pay over the phone or you pay online, I just want to note that we do not accept credit card. However, we do accept checking and savings account numbers for online and over the phone payments. All right. So I have said a lot in a short time, and I want to acknowledge that there is free help, lots of free help available to help you with this process. Um, you can get help through customer service. You can get help through community partner organizations. And I'm just displaying our number here, which is 877-623-6765. And you may also see the Health Connector at a local event. We have lots of support in Massachusetts through community partners. We have trained and certified navigators as well as certified application counselors. They can help you not only now with your application, but they can help you throughout the year, just keeping you on track. If you have questions about a letter you've received, if you have questions about a plan detail, these folks are fantastic, but it's best to call ahead to make an appointment. And you can find help near you by going to our website and doing a search, entering some zip code information and doing a little search for assistance. Now, many times on these webinars, we have questions about um, households or families that have maybe one person who's on Medicare or maybe transitioning to Medicare at some point. There are counselors who are specifically trained to help with Medicare questions, and they're known as Shine counselors. So you can reach them at 800-243-4636. Or you can go on to mass.gov and do a search for Shine counselors. And you can also see here there is an email address for the Shine counselors, the program. All right. So I am going to call upon my colleague, Melissa, to join us at this point. And I'll just share the first couple of slides, Melissa, and then I will stop sharing my screen.
Okay, thank you so much, Nikki. Okay, so I am going to go over some hands-on information. So the first example is a new applicant looking for a plan. So this applicant is eligible for a ConnectorCare plan type 3D. The applicant recently had some unexpected expenses, car repairs, etc., and wants coverage, but wonders what their options could be. They don't have a PCP, but know they have a chronic condition that they use to take medicine for. They'd like to get care at the Family Health Center of Worcester. What shopping tools can they use to compare their plan options? Next slide. Thank you. So I'm going to be demonstrating this member's information. For example, we have here that the member has a household of one, it's just an individual, age 36, an income of 45,000 annually, zip code 01610. And then we see that this person does have a medication that they would like to see is in network and a hospital that they go to. So for this person, I'm going to show you the Get an Estimate tool, which is a great tool that would provide a brief overview of what exactly this person would be eligible for and how much this person would be saving. So I am going to actually share the screen now. One second. And can you see my screen?
Yes, perfect.
Okay, perfect. All right. Okay, so this is our home page, and this is your starting page. So from this page, you have a lot of resources and tools. But for this demonstration, I will show the Get an Estimate tool. So if you go on top on the right-hand corner and hover above Get an Estimate, you have two options here. Either choose from individuals and families or businesses. I'm going to choose individuals and families, and I'm just going to click on that. And then here we answer a few questions regarding this household of one. So the first question we have here is the coverage year, which would be 2025. Then we want to enter the Massachusetts zip code for this person. And for the example, it was 01610. And then if you remember that this household income is 45,000 for the example that was provided, it's only one person applying, and that person is 36 years old. And then if you look to the right-hand side of the age of head of household, you have a few more options here. You definitely want to click that this person needs coverage, but you also have if this person is pregnant or if this person is disabled or blind. And these options here determine eligibility, but we won't be clicking on those two. We're just clicking on that this person needs coverage. And then we want to go to our results. And then we just have a quick reminder that this isn't an application for health coverage. This is just a demonstration, so we continue. Okay, so now we have a breakdown, the estimated eligibility. So this person is definitely eligible for a ConnectorCare plan with an advanced premium tax credit, which means pretty much that this person will be awarded a tax credit of, let's see, 227 is that amount. And then this person is eligible for silver plans with monthly premium as low as 147, which is great. And then if we continue to scroll down, we have a few options here, a couple options. We can either go and preview the plans or we can go right into the application, but we want more information regarding the estimated eligibility. So I will click on preview plans. Okay. And now we have a further breakdown of this household of one. So we see at the very top details regarding this person. So this person is eligible for a Connector Care Plan Type 3B. They also show you where this person falls with the tax household FPL, which is the federal poverty level. And then we also have the monthly APTC, which is the advanced premium tax credit for this household. So this person is awarded 227 advanced premium tax credit. So if we scroll further down, we have more of a breakdown. So we have what is available for this person as far as a carrier, the plan name, the coverage level, the monthly premium, the advanced premium tax credit savings, the Massachusetts state savings, and what you would pay monthly. So I will just go over the first example here. So looks like this person is eligible for their WellSense health plan, and that plan is a standard silver plan. So this person would have a monthly premium of 447.41. You take that and you subtract 227 and you have a Massachusetts state savings of 73.41. So that would pretty much be how much this person would be paying. And then we also have other examples here. So it just pretty much gives you an overview of exactly how much you would be saving with each plan, which is a great tool to have to see, exactly how much you would be paying. So this is a great tool to have. So if you scroll down further, you can either go ahead and apply, or you can start over and make edits to this demonstration here. But for this example, I want to check one more thing regarding this household.
Melissa,
Yep,
whoop, could I just stop you before you move on from this? Could you scroll down? Because I just want to clarify something. I want to ask you a clarifying question. So
sure.
you said this person, so let's just look at the WellSense plan because I think that's the lowest cost plan in the area for them.
Yes,
447 is the actual plan amount, how much it would cost. The 227 is the federal contribution, right?
yes,
And then the 73 is the state contribution, 73.41, I believe.
yes.
Okay. So this person's monthly premium, they would be comparing the amounts that are in the last column, really, as if they said, okay, I'm going to take the full APTC, the state dollars, there's no choice there, right? They get the dollars.
Mhm.
So they're really comparing, like if they're thinking about just the cost for right now, I know you're going to get into the other parts, but if they're just comparing the cost, they want to look at the last column, right?
Oh, yes, definitely. I'm sorry. I couldn't see the last column, but yes, you definitely want to. So the last column is actually how much the person would be paying per month.
Awesome.
So yeah, for that example, for the WellSense example, it would be 147 per month.
Thank you so much for clarifying that.
Oh, sure. Thank you for mentioning that. Okay. All right, so let me go to the next demonstration. So if you go to the top and you click over the Help Center, you have a few options here, resources and tools. I'm just going to scroll down three and go to our Resource Download Center and click on that. And from here, we have the Plan Finder tool. So if you remember in our example, this person was going to the Health Center of Worcester, and they also had an asthma medication that they were using. So when selecting a plan, you want to make sure that these two important things are in network with whichever plan that you select. So I am going to see for this example if those two are within the network. So if you click on Use the 2025 Plan Finder tool, and then it brings us to this page here. So we want to continue. Okay, so here we're just going to answer a few more questions like we did in the last example. We are going to use the zip code that we used for the last one, which is 01610. And then number two, do you qualify for the ConnectorCare plan? And yes, this person does qualify. And then what type of ConnectorCare plan type do you qualify for? And this person had qualified for the plan type 3. And then we want to continue. So here we actually don't have a name of a doctor or provider that was in the example, so we can continue. But we do have a facility name. So this person actually goes to Family Health Center of Worcester. So I'm going to start typing the name, and sometimes it pops up with just a few letters here. Okay, so yep, we found it here, Family Health Center of Worcester. And then we continue. All right, and then also this person has a prescription, is an asthma medication, and that medication is called Pulmicort. So again, I just type a few letters of the name, and then we have a selection here. So we want to also focus on the dosage form and the strength. So this person is taking a dry powder form, 90 strength. So I want to find that for this example, and I found it here. So now we're ready to compare plans. So here we have a breakdown of 7 plans that are available for this individual. So it's a breakdown of the plans available in that area. So what we're looking for is we want to check to see if their facility and their medication is in network. So for this example here, I'll go with the first one. It looks like HMO Blue ConnectorCare 3, which is the Blue Cross Blue Shield plan. And then if I go to your drugs and I hover above C list, it looks like this medication is actually in plan, which means in network, which is great for this person here. And then it looks like also their facility is in network because it is listed here under the facility. And then we continue with the next example, same thing, and it goes on and on with each plan. So this is basically a great way to pinpoint exactly what is the best plan that is available and to make sure that everything is in network. So that is great to have. And then just one more thing I want to show, and then we can move on to questions. So then if I go back to the starting page, which is our home page, and we go back on top of this page and we go to make a payment. And we have 2 options, individuals and families or businesses. We select individuals and families. And here, this is just a quick way, a quick reminder of making payments to the Health Connector. There are four ways to make your payments. You can either go by phone, in person, or by mail. And you can also log in and make a guest payment. But this is just information on how to do that. We have a great option here of auto pay if you wanted to do that. The forms of payment that is accepted is checking or savings account. Unfortunately, at this time, we do not take credit or debit, and no other methods such as PayPal. So I'm just going to scroll down, and then we have information and ways in which you can make your payment. Okay. So I'm going to stop sharing.
Actually, Melissa, if
Oh,
you want to, whoops, it's okay. I was going to say, if you want to keep it on our homepage,
sure,
feel
definitely.
free, just in case we want to navigate to anything or need to show anyone anything. But
Sure. Yeah.
Nuri, Thalia, we're ready. We're ready for you with any questions you have. I saw that you folks were able to answer a lot
Yes,
already, so thank you. I know there were lots of questions.
we have a ton of questions from folks. I guess Melissa, we can get started on payment since that was the last topic area that you touched on. Folks are just wondering exactly what the deadline for payment is, and whether or not they have until midnight on the 23rd of a given month, or is there some like leeway time for that payment to actually process? Just keeping in mind your deadline, if you could clarify that.
Okay.
Melissa, sure. I feel like you know.
Okay. Okay. Thank you. So the deadline is the 23rd. As far as the specific time by midnight, that is something I actually would have to double check. I'm not quite sure about that. Nikki, do you know if there's a specific time?
I, let's double check that and we can include it in the email.
Okay, perfect.
Thank you. And Melissa, you shared in the demonstration in the visual, and there were results for a silver plan type. Can you just clarify whether or not that means that that particular individual was not eligible for others, just so that folks know as they're going through this process what to expect, and if they see that it is a specific metallic tier, does that mean that, they might not be eligible for others?
So,
If that makes sense.
okay. So in the example, so it broke down the carrier and the specific plan types. So if that individual, let's just say, didn't like the WellSense plan, they can always select another type of carrier. But I believe they are all silver HMO plans, if that's what you're asking. I'm
So
sorry. Yep.
let me just rephrase my question. I guess if someone were to use the estimator tool and they have specific results that are generated, what does that mean then for other options? Are those their only options, or should they go based off of what was generated in the estimator tool?
So yeah. So specific to what was, yes, they should go by the estimated tool. Yes.
And so can I also add to that? Because I think so for the example that was used today, that person was eligible for a ConnectorCare plan. So all the plans that we're displaying did show as silver plans because that person was eligible for a ConnectorCare, the ConnectorCare program. So all of the ConnectorCare plans are based on the silver metallic level. But if someone, I don't know, Melissa, uh, love your thoughts here, but part of me thinks like the estimate tool is just that, it's an estimate. If someone should, if they, I almost feel like they should complete a full application to really to see exactly what is available to them because of course all the plans that are in their area are showing. but the pricing could vary. Like, right, the pricing could vary, meaning like once all of their income is entered, and because we ask a lot of detailed questions, I think that's going to be the truer form. And remember, getting an estimate, getting a quote is not a commitment. You don't need to, even if you complete an application with us, you don't need to take our coverage. You don't need to enroll with us. It is still your choice, your option. I hope that helps. And Melissa, if there's anything else you want to add.
No, that's perfect. Thank you for clarifying.
Thank you, and apologies for just the confusing wording on that question.
No, that's okay.
We were able to answer a lot of these, but I'm sure that people are still having questions about Cobra generally. If you guys could provide just like a top line for Cobra, anyone who has their Cobra coverage ending soon and what should they do, etc., if they're even eligible for the Health Connector, that'd be great.
Yep, I'll do my top line and then Melissa, please add in. So Cobra, if you haven't enrolled in Cobra yet and you're comparing options, please come to us first to see if anything more affordable is available through the Health Connector that and is a plan that you want to be enrolled in. The rule is that once you enroll into a Cobra plan, you have to keep that Cobra plan. You can't cancel, quote unquote, anytime and then change your mind and come to the Health Connector. However, there is a caveat to that. Let's say you're someone who is offered Cobra through your former employer, and that employer tells you that they're going to pay for Cobra or part of it for 3 months or 6 months. After that subsidy goes away, if you look at that amount and say, this is too much money for me, the fact that you were getting some help paying for it and then the help went away, that is a qualifying event and you could come to the Health Connector. If you enrolled into Cobra, let's say in February or March, and it wasn't the case, you were paying the full amount, and you needed insurance, you wouldn't be able to change or do anything about that until the next open enrollment. I hope that's helpful. Melissa, did I leave anything out?
No, I think you covered everything. Great. Thank you.
And then I guess a question speaking more generally, if folks have access to coverage through other means that's not Cobra, for an example, they're a dependent um, on their parents' plan, and just an individual who knows that their coverage might be coming to an end at some point this year, what should be their next steps? What do you guys recommend given that we're in this open enrollment period? Do they need to act now or can they wait?
Melissa, do you want to take that?
Sure, yeah, definitely. So losing access to coverage is a qualifying event, so you can actually enroll at any time. It doesn't specifically have to be open enrollment. And if you're looking for a specific time, you would always want to make sure that you enroll the prior month by the 23rd. So let me just give an example. So if you wanted coverage for February 1st, just make sure that you do the application and enroll by January 23rd. That way there's no gaps in between.
And then can I add something on a different part of that, Nuri, a different part of the question? Let's say you are a dependent and you're dependent, but you want to just do these things on your own and you'd like to apply for your own health insurance coverage. Um, you have to be filing taxes on your own. You can't be someone's tax dependent. When you're completing an application, we're looking at the tax filing households, and you're asked questions about whether or not someone else is claiming you on their taxes and claiming you as a dependent. So you would need to be filing independently in order to complete an application independently.
Thank you, Nikki. Thank you, Melissa. Um, Folks are interested in learning more about, I guess, Melissa, since you have this up, how they're able to have more insight into what each plan covers.
Oh, yes, that's a great question. And I love when people ask this question. It's my favorite part. So yeah, shopping, and you have questions regarding a specific plan, at the end, at the shopping experience, when you have the list of carriers, there is a way that you can click on one of them, and it kind of gives you an overview of the benefits summary for that plan, which can help you, determine which plan works best for you. It pretty much breaks down how the plan works and, if you need to have a copay, what is covered under the benefit. And then also a customer service number is included. So if you have a question and it's not provided in the benefit summary, you also have the option of calling and getting more information. That way, if you're having trouble picking a plan, you know that once you're able to get more information, you're more confident in selecting a plan at that point.
And Melissa, where can people learn more about dental coverage?
So dental coverage. So when you go into the application, again, and you select, you have like a overview of what's the carriers in the city where you live. You can see exactly what is covered in that area. And again, it's a part where you can click on the carrier and get more information of what is exactly covered for that dental plan. There are some different requirements for dental. Sometimes there's a waiting period. You definitely want to check for that. And you definitely want to check the percentage that's covered for that dental plan just to make sure you get the best plan. But yeah, it's the same as the medical. You get a list and you can click on it to get more information.
Awesome. I do want to know that there's still a couple of questions regarding income in the Q&A, and I know that this was touched on, and we are running, we're almost at 1 o'clock here, so maybe we can provide folks with some additional resources for reporting their income in the follow-up email.
That sounds great. Happy to do that.
And earlier in the session, we did have some people slightly confused with Mass Health and the Health Connector, and people were wondering if they could, be enrolled in plans by both programs. So if someone could just quickly touch on that. We do have 2 minutes left, so I want to be mindful of time as well.
Okay, so I'll try to do a very quick explanation of our relationship and what someone might experience. But very quickly, the Health Connector is the state's health insurance marketplace, separate and distinct from Mass Health. Mass Health is our Medicaid agency in Massachusetts. So when someone applies through the Health Connector or through mahealthconnector.org, pardon me, we share an application. Usually, or what should happen is an individual is either going to be found eligible for one type of coverage or the other, or none at all, right? If someone is eligible for Mass Health, they aren't going to be eligible for a Health Connector benefit. However, sometimes if let's say someone is eligible for ConnectorCare, which is a Health Connector plan, they could also have access to Mass Health health safety net benefits for a little bit of time, but that does go away. And it's also important, I guess, to maybe say that sometimes individual circumstances change. So the income goes up or income goes down, and people might move between a Health Connector plan or a Mass Health plan. Melissa, is there anything else you'd include in that?
No, that's perfect. Thank you.
Thank you, Nikki. So, again, acknowledging that there's still a ton of questions that we weren't able to get to live, but as a reminder to folks, we will be sharing materials after this webinar. So your question could be answered there, or, reach out for help. Our customer service is available. We have local assisters. And of course, people can log into the website and navigate it on their own as well. But thank you all for joining our webinar today. From everyone at the Health Connector and all of our sisters across Massachusetts, we thank you and be safe and well.
Thank you, everyone.
Thank you.